Good morning to all. I am Marie-Christine Balamour. I am the Secretary General of Public Safety Communication Europe. And we are really very pleased to organize today this second webinar on crisis management, surveillance, and digital ethics in the COVID-19 era in close cooperation with 4 distinguished university and research centers. PSCE, just a few words about our organization, is an organization that is gathering 3 communities, practitioners, that could be Civil Protection Agency or Ministry of Interior, or a volunteer organization like the Red Cross, for example, industry and research. We are defining roadmaps and policy for the evolution of public safety communication and communication systems. And we are really stimulating a continuous dialogue between our 3 communities and trying to shape this dialogue and answering some questions by what are your needs, what are your requirements, what are the possible solutions, and in the future, what could be the solutions. Digital ethics is a dimension that we want really to take into account from the very beginning of this process. This second webinar is following the one that we are organizing, the one that we organized in May, earlier in May, on social tracing apps. And this was organized around technical issue, and we had also presentation from the European Commission about the toolbox that is defining guiding principles for the member states to set up social tracing apps. The current fight against the COVID-19 is generating a lot of technical solutions to monitor or to try to slow down the spread of the virus. Social tracing app, as I mentioned, but also intelligent camera to measure body temperature or to check the respect of social distancing are really blooming and could be used in public spaces, but also at work space. National protection authorities and fundamental rights agencies are producing opinions on a regular basis since a few months now. And these opinions are really highlighting overarching principles that are governing our data protection rights and our liberties. So I'm really pleased to introduce briefly our speakers of today. We will have to start Mr. Kees Bosman from the Free University of Amsterdam. Is an associate professor and research manager at the Department of Organizational Science. Monica Buscher from the University of Lancaster will give also state of the art. She's a professor of sociology and director of research for the Department of Sociology and also for the Center for Mobility Research. We will have also a presentation from Mr. Calvo from the Imperial College London, and he's chair of design engineering at the Dyson School of Design Engineering. And we will end this webinar with a joint presentation from Department of Health, Science and Technology at ETH Zurich, Switzerland, with Mr. Jonka, who is a senior researcher, and with Mr. Schneiber, who is a research fellow and collaborator, scientific collaborator. Before launching the presentation, I would like to give you some governing rules for this webinar. We have more than 150 registrants, so you are all muted. You have the possibility to ask questions, and by using the chat, you will see the function at the very bottom of your screen, so you can use this and ask your question, and we'll select a few ones at the very end of our webinar. So now I'm pleased to give the floor to Mr. Kees Bosman.
All right. Thank you so much. Thank you, Marie-Christine, for an interesting introduction. My name is Kees Boersma. I am in the Free University of Amsterdam, working in the field in teaching and research in crisis and disaster management. I do that from the perspective of organizations and governance. And I'm pleased and honored to have a sort of the introductory talk for this webinar, in which we will have a discussion and sharing thoughts and ideas on crisis management, surveillance, and ethics in the COVID-19 era. As the title suggests, there are many things to discuss. I mean, crisis management, surveillance, ethics, digital ethics, and the COVID-19 each deserve a webinar in its own right, maybe more than one. Meaning that if we combine those issues and topics, we are really interested in, let's say, a holistic understanding of what is going on in the COVID-19 era in relation to measures that are being taken from a crisis management perspective to, let's say, to get the virus, the crisis under control. What the measures means in terms of controlling the behavior of people, institutes, and organizations, and really seeing many digital tools being applied in order to get that difficult situation under control, which actually cries for a reflection, an ethical reflection upon it. So those topics are central in our webinar, and in the coming 5 or 6 or so minutes, I would like to introduce those topics a bit more in depth, and then give the floor virtually to Monica, who can elaborate on the ethical dimension. So the era we are living in, we are all facing, which is in a way a unique situation, the same crisis situation. From a crisis and disaster study perspective, it is an interesting time. I mean, there is devastation, but from a scholarly biased interest, it's an interesting crisis versus crises that are suddenly happening. So the COVID-19 crisis is what we call a slow-burning, enduring crisis that is characterized by a situation in which the crisis is not just a sudden onset causing problems for communities, societies, and also for crisis response organizations, but having a long-lasting impact on societies. And since it is a pandemic, it is a worldwide crisis. It is also an institutional crisis, I would argue, referring to the situation that the established institutes, both crisis institutes as healthcare organizations and what have you, trying to collaborate in their efforts to fight the crisis, are not always and in a good way organized to do so. So next to a health crisis, we face global, national, and regional institutions really struggling with responding to the crisis and to set up proper organizations. At the same time, when you look at how society responds to the crisis, you see a combination, I would argue, of a resilience society, meaning that we are not just facing victims of the COVID-19 virus, but citizens, and actually I would argue all over the world, pulling up resources, organizing themselves in various ways, spontaneously in emergent organizations, next to the official response of the formal authorities. At the same time, you see that, and that is what a crisis would reveal anyway, any crisis, is that some people are more vulnerable to the virus than others. Meaning also that not everyone is resilient in the same manner, in the same way, deserving different forms and ways of attention. Now, we all see and face and experience containment measures that are quite standard for fighting a pandemic. In that sense, physical distancing, isolation, testing is not something that comes out of the blue. These are measures that really are textbook measures at times of infectious diseases, let alone pandemics. They are put in place, of course, to, let's say, to get the virus under control and the spread of the virus under control. Physical distancing, quarantine or isolation, to test people and act upon it. Important measures to get a virus, a disease under control. At the same time, it has severe impacts on our social lives. That is what we all experience. That's the COVID-19 era. They lead potentially to an increased and invasive surveillance of our lives. And what we see in crisis situations like this, a crisis situation is also an opportunity for formal authorities to say as a window of opportunity or a policy window to put in place measures that are intrusive, that are having a huge impact on our daily life. And the implementation of such measures, as I argued, found in the fight of the virus. Putting the measures in place, like physical distancing, controlling the physical distancing, putting people in isolation, and then in particular those who are vulnerable to the virus, there is a need to collect data on citizens and citizens' behavior. On a large scale, I would argue. It is well known in crisis studies, but also in surveillance studies. Crisis situations are seen as opportunities, are seen as moments in which formal authorities see the legitimation to do so. To have extensive surveillance, can be seen as sort of a trade-off. At the one hand, getting the virus under control, so the health and the safety and security of the people. At the same time, it comes at the expense of the loss of civil liberties. And that is what you see happening in various ways, but see happening all over the world. There are always trade-offs in crisis management. Famous phrase, "I have nothing to hide," an example for that, because people would argue we give away some of our liberties for the sake of our safety and security. What makes this crisis in particular interesting is the slow burning characteristic of it, meaning that they have the crisis has a long-lasting effect, and so do the measures. Testing people, following the behavior of the people and how they respond to measures are also seen as a legitimation to what we call the reopening of the societies after in some places, quite severe lockdown. It means that, and that's the implication, that the health-related emergency measures that we are facing right now, the physical distancing, the measures that are being taken, that they may remain over a long period of time. Don't fade away so easily. So what does it mean in terms of the questions that we may ask ourselves? In relation to crisis management, you see that crisis organizations established and emerging at the same time are facing challenges, because you can put information systems in place, COVID-19 apps, like dashboards that are being implemented right now at rapid speed at different levels. The WHO is implementing its dashboard with all kind of information on nation states, but at the regional and local level of municipalities, you see the same. It's not that straightforward. Information in crisis situations also request the sense making. What does the information mean for those who are trying to act upon those information? So it's disrupted in the sense that it can lead to information overload, difficulties in translating the data from different levels of authorities and organizations. There are all kinds of new liabilities and responsibilities, and so forth and so on. In relation to surveillance, you see that measures taken to control the virus are also trying to control the behavior of the people. And not everyone is controlled in the same way. Social sorting, profiling, discrimination are issues that are worth to discuss in this regard. What we are aiming at, and now I give the floor to Monica, is organizing a special issue in which we would like to combine all those issues and elements that play a role in our COVID-19 era. And so with Monica and with Chiara Fonio in the Journal of Crisis and Contingency Management. Monica, thank you.
Thank you, Kes. Yes, Monica, the floor is yours.
So against that background of surveillance society that Kes described, I'd like to take stock of the state of the art in digital ethics. And we'll hear some of the experts in this webinar, but of course there's a lot more to draw on. So this is intended to broaden our awareness, and that's work that I'm doing with my colleague Jaula Karasidou and Stephen Wilkinson. And the challenge of digital technologies and the possibilities of digital technologies for public protection and disaster response are enormous. The two quotes that you see capture some of that enormity. First, Naomi Zak, a disaster ethics professor at City University of New York, challenges us to act ethically no matter how bad things are. And the second quote hints at the possibilities when we can track and trace people and their contacts, survey their movements, everyday patterns, communications, and know their gender, ethnicity, health status. It changes what it means to be a person, a citizen, an emergency response practitioner. We can be sorted according to vulnerability and danger, protected and cared for, but also controlled and held responsible in new ways. Digital innovation is disruptive innovation. It engenders far-reaching changes in how we do PPDR. And there's something special about how we have so far designed digital data. We've made it invisible. It can be shared without trace. It can be stored, combined and analyzed in ways that are unprecedented in history. And the digital ethics debate instigated by the data protection supervisor highlights that even our state-of-the-art responses to this, like the General Data Protection Regulation, can't really solve this. The GDPR is designed with outdated understandings of personhood and data. For example, rules like purpose binding to specify the purpose of the data collection and then not allow any changes to this undermine the potential of big data analytics. So it deprives us of a really big potential. And it doesn't stop re-identification from combining different pieces of data. So we are trying really, really hard, but the digital ethics challenge is like squaring a circle. To develop cross-border contact tracing as Europe unlocks, for example, the interoperability specifications for cross-border transmission between different contact tracing apps that the EU member states have agreed upon. The designers have developed sophisticated data privacy mechanisms like active trust and encryption in transit, ensuring GDPR compliance. But GDPR compliance doesn't make it ethical necessarily. There is more to think about, and there is a caveat here to say that it needs to be specified in more detail after the European Data Protection Board has published their opinion. Well, now they have, and they ask for more than privacy protection. The use of contact tracing should be voluntary. It must be designed so people trust it and want it, and data minimization is mandatory. What this example shows is that ethical mobilization of the enormous power of digitization is a moving target. It is contextual, so different countries have different tolerances, and yet they need to share as we travel, as we are so mobile, and designing for that interoperability is really complex. There are many ambiguities and no easy solutions. And the state-of-the-art response to this challenge of squaring the circle is a process of digital ethics. Researchers are developing tools that can help technology designers, procurers, PPDR practitioner organizations, and citizens to assess the ethics of innovation, asking, is it necessary? Is it proportionate? Is it temporary? And the answers here are not yes or no. It's on a sliding scale of more or less for a nuanced understanding and capacity to modulate the potential of technologies and their risk. And there are many such ethical and social impact assessment methods or guides emerging. And this is an example of an ethical assessment framework by the Satori project. And at Lancaster, we are, in collaboration with PSCE, developing a platform, Is It Ethical?, to support iterative assessment as part of the design process and innovation process in organizations, specifically in PPDR. And we are also working on a societal readiness assessment framework that explores how we can develop technologies that are ready and good for society. So the technologies are being assessed. And this also includes an assessment of the readiness of society. So are citizens technologically and ethically competent to use the technologies and trust technologies that are complex in a world where personhood and citizenhood is changing? And this is inspired by the technology readiness levels framework, with SRL1 at the bottom, a concept for systemic change, and SRL9 at the top, an implemented technology with good social and societal outcomes. So you could argue that digital contact tracing has rapidly progressed to TRL9, 8 or 9. But in terms of the SRL levels, it's at level 1, at least in relation to European societal values in some cases. So, for example, South Korea has opted to use geolocation data without seeking consent. It publicly posts information on people's movements in the days before the diagnosis, based on cell phone data, and credit card records and surveillance video. They don't include the names, but age, nationality, and sex are mentioned. And in contrast, Germany is perhaps at SRL 5 or 6 able to demonstrate positive outcomes with more privacy-preserving techniques. So we are developing some socio-technical and technical responses to the challenges of digital ethics. But in some, the state of the art is that we know a whole series of big questions. And we have some of these constructive responses, but by no means enough. So our questions start from asking, which ethics are we talking about? Do we need to just focus on the consequences of our actions, so save the most that can be saved, no matter how we do it? Or do we need to preserve ethical principles as deontology would require us to do, like privacy? Or do we need to think about virtues like justice and preparedness, or all of them? And it goes down to questions about if digitization changes personhood and citizenhood, how can and how should we design on such shifting ground? And PSCE recommends, and I do as chair of the research committee, practitioner-led, iterative, experimental co-design with public engagement. And that's how the societal readiness levels assessment emerged. And so the three speakers that follow now will give us some deeper insight into what we should pay creative, innovative attention to. So I'll hand over to Raphael now.
Hi, can you? Thank you very much for inviting me, Maria Christine. It's a pleasure to be virtually here. So all the content I will be describing now, it's aligned with the ethos in our research lab at Imperial College London and previously at my research lab at the University of Sydney. And this is that all technologies should be designed to support psychological well-being. So that means not just about health technologies, it is not just about this emergency COVID situation, but it should apply to all the technologies we use. And you will see how some of these ideas will eventually transfer to the other domains. And in this process, we use a number of psychological theories for well-being, but we have found self-determination theory, that is a theory of motivation, particularly useful in the design of technologies. First, because it encompasses three psychological needs. The first one, autonomy, that is the feeling of willingness and volition in action, is very much related to a lot of the ethical principles, a lot of the ethics pillars that we have been discussing. The second one, our need for competence of feeling able and effective, is particularly significant in human-computer interaction. We constantly are worried or concerned about improving the usability and making technologies easier to use. And finally, relatedness, where we can feel connected to others in meaningful ways. So we try to bring this to all sorts of technologies. I will be focusing today just on autonomy, because I think this is particularly important in the situation that we are in now and for the sort of technologies that we are discussing in this forum. So autonomy in this psychological theory refers to endorsement, to a willingness to engage in a behavior. This is very different to being independent. That confusion sometimes generates a lot of trouble, both in the design and in the ethical considerations. So it's quite important to keep it in mind. We sometimes relinquish some intention, some ideas of using a technology like pleasure for doing something, for some goals and values that are more important to us. And I think that's very important in the sort of technologies that we're talking about. So autonomy frustration, when we are talking about the user experience, can be described sometimes as these examples. I hate it when it doesn't do that. It's too restrictive. It doesn't fit my situation. These are the sort of statements that users will tell you when you inquire about their psychological need satisfaction. We know from the literature that autonomy is frustrated when it feels controlling, when it feels that it manipulates us, when it's intrusive, nagging, inflexible, when it's surveilling us, when it's action that it's taking without consent. There's a huge body of literature that shows the impact of autonomy frustration in our relationship with our children, relationships between teachers and students, between doctors and patients, across different cultures, at different age groups, etc. What we are trying to do here is to bring this to technology design. And there are many examples for where it's done. Obviously, we're trying to find design approaches that autonomy is supportive. And this is an example here, notification settings. When we are receiving a lot of notifications, we need to feel more in control of the distractions produced by the technology, for example, the mobile phone. So being able to turn off notifications give us some of that sense of control. Sometimes I would like to be able to change certain features in the technology, or if I accept, let's say, a contract or an agreement to install an app, I want to be able to go back on that decision. These are design options that are very important for supporting autonomy. So what I will be talking about now is this model of motivation, engagement, and well-being that we have used in technology design, trying to adapt it to the particular equation of COVID-19 technologies, surveillance technologies, and other technologies that we might be developing in the near future. One thing that is quite important that we brought up in a recent BMJ paper is that it's not a zero-sum game between safety and privacy. When both sides endorse well-being as a jointly valued goal, health surveillance can be a positive sum game, both effective and chosen freely. And in order to achieve that, a participatory design approach is essential. I will say that this is essential in all technologies, but particularly in health-related technologies. And in this other paper, we describe a process in which we can bring kind of the biomedical ethics framework to the design of health technologies. So in the first level of these 6 spheres, we're talking about adoption. Adoption is the experience we have about a technology before we even install it, before we start using it. So we have perceptions about a technology that come from the media, perceptions that come from about the technology that come from our relatives and friends that tell us about how they feel, what their experiences are, etc. And today, when we design technologies, we need to take this into account because adoption will be limited by misinformation campaigns, by technology and political leaders who are spreading other ideas about the sort of problems that we're facing. A second level is the interface. And this is often what the designers tend to think most about. So when I design a mobile phone app, it will refer to the sense of autonomy provided by new options and the interface itself. But then, and one example here will be the option of being able to opt out to certain features, maybe surveillance features, now and in the future. So that level of customization adds to our sense of being in control of the situation. The next one is about tasks. So the technology often creates new tasks that are a series of steps, are each of the steps that we must follow in order to accomplish a goal, a behavior. So these individual tasks are very important. For example, if I want to align this with my values for health, it might allow me to track my steps, track the number of people I meet, etc. And these tasks may or may not support my sense of autonomy. Then we have the behavior. These are goal-oriented kind of activities, a series of activities that are encompassed within a certain important behavior to our individual psychology. And in the UK, I think the campaign about supporting, protecting the NHS and saving lives shows it was an effective campaign to connect people's behaviors to the impact that it will otherwise have. So I may want to go out, but I limit my activities outside in order to protect this, that it's a more important value. Then we have the level of life. So all these behaviors eventually will have an impact on our quality of life. We want to design technologies that improve this life satisfaction and improve well-being in the longer term. And this sometimes could be an opportunity to look at the silver linings of the crisis, bringing that into the technologies, into the messages that we're trying to spread. This one is an example of one of those, what I believe, positive stories. The consequences of this, if we do it right, could have a positive impact on the way we live and making a more sustainable world. Because it gives us the opportunity to, it forces us to try things that will otherwise have been very difficult to try. Finally, I think there is another level that it's also beyond the direct use of a technology. The previous four are when I'm using the technology. The society level is the sphere where people who don't even use the technology are affected by it. So it could be the family members. If I install one of these contact tracing app, it could refer to the people that have not installed it, but will be affected because they will, whose data could be passed on to others, or who, will be influenced in many different ways. I think taking this into account is very important because, again, as the previous speakers mentioned, this also has a particular impact on BAME communities, in disadvantaged communities or groups of particular race groups. So we have to take into account what the impact of our behaviors and the use of this technology will have on others that may or may not be installing and using this technology. Before closing, I wanted to bring your attention to this special call for papers on an issue that I think all of you will be interested what happens after COVID, crisis, ethics, and society, technical change, socio-technical change. We have a fantastic set of guest editors, but also more generally, I'm the co-editor of the journal, so I would like to invite you to submit papers on this topic or other topics to this new journal. Thank you very much.
Thank you. Thank you, Rafael. So now we can move to the joint presentation from Marcello and James.
Yes. Thank you very much, Marie-Christine and Monica, for the invitation. It's really a pleasure to be part of this very interesting webinar and share with you some of the insights of our current work at ETH Studies on ethically conscious use of data and apps for pandemic response. So I will start with an historical observation. And the historical observation, since this looks like, is that the current COVID-19 pandemic is unprecedented by many respects, one of which is the fact that it is occurring in a much more interconnected world and much more digitized world than any other epidemic of the past. Just take, for example, the fact that the amount of data generated by humankind since the origin of our species until 2002, which was the year of the first SARS-CoV outbreak is now generated within only a few minutes, 6 to 7 minutes, a phenomenon that is often labeled as big data. And further, AI systems have reached today a much greater degree of sophistication and reliability compared to 2 decades before. So if you move to the next slide, I was contextualizing the context of the current pandemic, which, as I said before, is unprecedented by many respects, one of which is the level of interconnectedness and digitalization of the world in which is taking place compared to any other outbreak of the past. If you take, for example, the first SARS-CoV outbreak from 2002, the amount of data that is available and is constantly generated today in 2020 is significantly higher than the amount of data generated by mankind in 2002, which was the year of the first SARS-CoV outbreak. And the same amount of data produced since the origin of mankind until that year, 2002, is now produced only within a few minutes. And combined with this big data trends that we're currently experiencing, there is also an increased degree of sophistication and reliability of AI systems. Artificial intelligence has reached a much greater degree of complexity and sophistication and applicability to public health compared to 2 decades before. And based on these contextual factors, Efivayan and I have argued in an article that appeared at the beginning of the pandemic that it is imperative from an ethical perspective to leverage these big data trends and intelligent analytics and put them to good use for public health. And we even argued in the same article that not using technologies that have the potential to mitigate the burden of the pandemic is not a morally neutral stance, but something that could have detrimental consequences for people. But this also raises a number of ethical concerns. This availability of data and digital systems also raises a number of ethical concerns that need to be carefully addressed. And this ethical challenges and concerns, many of which have been already very elegantly presented by Monica and Raphael, operate at 2 main levels. If you can move to the next slide. One level is the collection of data from the affected people. And here we've argued that the principle of proportionality should apply, meaning that the data collection must be proportional to the seriousness of the public health threat. It must be limited to what is necessary to achieve a specific public health objective, and it must be scientifically justified. And the previous speakers have already emphasized the first 2 points. I would like to emphasize the third point about scientific justification, because this is a very important concern. Monica has argued that emergency doesn't justify to discount ethics, and I would endorse this statement. I would also add that emergency doesn't justify to discount science. And that this is a risk of particular concern in the domain of digital technology, since all of you know that digital tech, especially technology in the telecommunication domain, smartphone technology, is characterized by a significant degree of hype, and therefore there is a legitimate risk that systems may be rolled out without adequate standards for scientific validity and without adequate validation through scientific studies and through the collection of scientific evidence. Next slides. At the level of data processing, this obligation towards proportionality and respect for autonomy, as Raphael presented, also entails that data quality and security controls are needed. This is particularly because data integrity weaknesses, which are very common when data are collected from personal digital devices, such as smartphones, can introduce small errors in one or multiple factors, which in turn can have an outsized effect on large-scale predictive models. and data breaches are also very important, because insufficient or ineffective data identification and biases in the data sets can majorly distrust in public health services. And distrust has already been observed in public health to be a determinant of lower health outcomes. So this is another ethical and social implication that should be taken into consideration. So this is the general frame of analysis that we're using. And we wanted to take a further step in trying to create a topology or a system mapping of this large variety of digital public health technologies that have been proliferating. I have to emphasize again that this article I've discussed before was written in the very early stages of the pandemic. So as new technologies were rolled out, we decided to map them into a topology and try to provide technology-specific ethical assessment. And this is what my colleague, Dr. Scheibner, will present.
Thank you very much, Marcello. That was excellent. And first of all, I'd like to thank the Public Safety Communication Europe for inviting us to give this talk. So now I will take over and give my presentation on public health technologies as we've defined them in our paper. So this is a paper that Professor Vanya, Dr. Ozgasa from the Berkman Klein Center, Dr. Aryenka and Joanna Slay and myself. Joanna is a PhD student being supervised by Professor Vanya, have developed, and it is currently being published under publication by the Lancet Digital Health Technologies Journal. So Marcello has covered the issues around the use of data. And now what I would like to do with this presentation is examine the 4 different types of digital health technologies, first and foremost, that we've identified that have been developed in response to this pandemic. Now, the first is one that we've obviously discussed already, and that other presenters, Professor Buscher and Raphael, have already discussed, which is the question of proximity and contact tracing. So these are tools for identifying, basically identifying the spread of individuals and their interactions with one another. Normally, what we've seen so far is that these are opt-in apps. They normally rely on Bluetooth data as well as cell site data, and they normally involve citizens who interact with one another. Then we have symptom checkers, so individuals can contact their local health department to confirm whether their symptoms match COVID-19, and these normally rely on, again, opt-in consent, but also provide the individual themselves providing data. By contrast, we can compare that with quarantine compliance, which is a tool that is used in order to ensure that individuals who are confirmed as infected do remain within their quarantine site. So normally, by contrast, consent here is not an option. Consent is, to use the technology is mandatory. And normally this relies on, for example, cell site data or location data to ensure that individuals remain in their location. And we've seen this piece to be used with very great effect in Taiwan, for example, which has maintained very low case levels. And then finally, we have flow modeling. So a number of companies that produce apps, so most notably Google, have attempted to use mobile phone data in order to identify the movement and to picture where there might be a interaction between different individuals that might encourage the spread. So the question is, what are the ethical concerns that might emerge from the use of these digital health technologies? And if I could move to the next slide. Sorry, slide 6. Thank you. So using existing principles, bioethical principles, we've developed a framework of the different issues that might influence and might be apparent in the development of these technologies. So for those of you who are not familiar with these bioethical principles, these are, we've identified in our case 6, so and separated out the 4 main principles that were identified by Beauchamp and Childress. So these are non-maleficence, justice, beneficence, autonomy, solidarity, and privacy. So as Marcello mentioned earlier, one of the key points in relation to non-maleficence, the idea that we avoid doing bad things, is this importance of scientific validity. So for example, ensuring that we have sufficient uptake of these apps in order to, for contact tracing purposes, for example, to ensure that there is sufficient information that can be gathered. Another important issue is this question of justice and ensuring that data is not repurposed. So for example, the Slovakian Constitutional Court struck down a new piece of legislation that was passed by the National Council in response to the crisis, allowing the government and the Department of Health to collect information about citizens from their cell phones. They were concerned about the repurposing of this data. And then finally, we also need to consider, as part of these issues, questions of digital inequality. So for example, a Pew Research study identified that many of many elderly individuals currently do not own a cell phone. So this can significantly impede the use of these technologies, as well as other issues such as that we've already discussed, such as consent and non-discrimination, transparency, and so forth. So slide. Thank you. So then what we've used is these principles in order to develop a series of recommendations for the development of these technologies. So many of these are, I apologize for the ambulance, many of these are already embedded within data protection and privacy laws, such as, for example, conducting risk assessments and privacy by design for technologies that are used to collect personal health data. But others of these are either technological issues or also ethical issues. So for example, avoiding lock-in and path dependency. You might have heard recently that the British government has abandoned its plans to develop its own separate contact tracing app and is using the Apple and Google consortium framework for contact tracing. And likewise, it is very important to distinguish the tools from the purpose for which they use. So for example, in China, there is some recent concerning stories about the use of Alibaba data in order for surveillance and so forth. And finally, a key part of this framework that we've developed, and this is something that we worked through as part of the actual design process of the article, was to test with other scholars to develop in an iterative fashion. So what I mean by that is that some of the ethical issues that are very important in the development of these technologies need to be refactored into the design process. And we can't just simply say, well, once we've developed the app, that's the last that we need to consider of ethics. This is an ongoing process. So that concludes my presentation slide. Our presentation, I should say. And our contact details of our colleagues are on the last slide. So thank you very much.
Thank you to all of you. I will try to pick up a few questions. There was one from Monica to Raphael, which is, let me take it. Yeah, you described the autonomy challenges in relation to individual citizen experience. What are your thoughts of this for emergency responder, for example, when they have to use triage tools and on a societal level?
I do think that we have to try to support autonomy at all the levels for all groups of people, including emergency workers. They are much more likely to be engaged with their work. There's already enough pressures on emergency workers. So when we design the technologies that they need to use, it's better if they're designing ways that they willingly want to use them. At the societal level, I haven't really thought about it. I suspect, so if the emergency, I'm not sure if the person asking the question is referring to how the technology will affect those who are not directly using the technology. So maybe the family members of the emergency worker or friends. And I do think that, yes, taking that into account will be important. But it's a challenge, obviously, because some organizations might want, for example, to always be contact tracing emergency.
The sound is not good. We cannot hear you, Raphael. I'm sorry. There is a connection problem.
Maybe if you mute Raphael while his connection recovers. I was gonna raise an issue that you highlighted, Marie-Christine. I think this question of why commercial operators are less trusted than governments is really interesting. There's a story about Latvia where citizens argued that a government-led design would be more trustworthy than Apple and Google. And of course, I mean, an obvious reason is that we already know that they will make use of the data in commercial ways. So that's one big reason why people would trust it less, I would say. But it's a really interesting discussion to have.
I mean, there is an ongoing discussion because you know that, for example, for the tracing app, France has chosen not to use Apple and tools, and they want to develop their own tools. But they're a bit isolated because many other countries have chosen to be maybe more rapid in the development and the availability of the tracing app. So that's an issue, and it's for me it's a bit strange to see that these elements are not really debated, and these options are not really publicly part of a debate about the risk also of using some other technology or comparing this. So I would like also to raise this question to Kes when you were mentioning that during the crisis we have maybe a different perception, of course, and we do a bargain on the trade-off between what is at risk and what we can accept. But when we see all the new development of technology, don't you think that in general, the level of acceptance of citizens about this new technology will change? So in a few years, we will not have the same perception of what is more important or what are the value, because it's an evolving process. So we will not get back to the situation that we were a few years ago with our perception and values. You are maybe muted, Case.
I'm not muted right now.
Oh, yes, it's fine.
Yeah.
Right now.
Okay, yeah. So yeah, that's partly an empirical question, and I also see some remarks in the chat box that some of the discussions we have right now are contract, and in the special issues we can promise that there will be more empirical contributions as well. But that is also due to the fact that we are facing the crisis right now, and measures are taken in the moment, and we have to see the impact of it. When it comes to the trust, I think the trust in the implementation of the technologies are also related to the trust in the formal institutions. So in my country, the Netherlands, the RIVM, so that is the governmental body who's responsible for the policy advice on the corona crisis, they are measuring the trust that people take in the formal institutions and the measures. So I think those two are related. When it comes to the long-term consequences, what you see that measures implemented to control the behavior of people, so I refer then to the surveillance aspect, that have a legitimacy in the crisis situations can have a long-term effect. Also, that is an empirical question, but we have seen, for example, that measures taken after 9/11 in the US still are in place. So it's not that once a crisis is over, whatever that would mean in the COVID-19 situation, but it's not that once the crisis is over, those technologies will be put aside. In one of my slides, I refer to function creep. So quite often what you see is that measures and technologies that are implemented for a particular purpose, then will use later on for other purposes as well. Well, that's a sort of a theoretical debate. What it now in the COVID-19 era, that is of course also partly an empirical question.
Thank you, Kees. Thank you, everybody. I don't know if there is a last question or last remarks, because we are coming to an end to our webinar. I think that we, because there were questions about also the availability of the slides. So later on, we will share with all participants the video of this webinar and the presentation as well. So that everybody can refer to that and have all the details that you gave in your presentation about the call for papers and your details. So I would like to really thank all of you, thank the speaker and the participant as well. I think that's a topic that is really essential for our society, and we should take this time for this debate. I would like also to announce our final webinar before the summer break. We will have also next week a webinar on managing COVID-19 with experience from practitioners and from national PPDR organization. So one will be dealing with public warning systems, the use of public warning system during the crisis. So that will be from the Crisis Center in Belgium. There will be one presentation also from Spain, how they manage the flow of call in Madrid during the COVID-19. So that will be the 112 Center will do this presentation. And then from Germany, it will be experience from a logistic point of view, how they manage the distribution of equipment and of testing to the different organizations that were in need of this equipment. So hopefully we can share this experience with a practitioner next week. So I really want to thank you all. I hope that you that gave us a lot of food for thought. And bye-bye and have a good day. Bye-bye.